Hi, I'm Dr. Egan, and today I'm going to talk to you about a couple different roles you might find in an audiology clinic. And those roles would be an audiologist, a hearing instrument specialist, and an audiology assistant. So let's get to it. The first one is an audiologist. An audiologist is someone who went to school specifically to specialize in audiology. Typically, they are a doctor of audiology who did 4 years of undergraduate in speech and hearing sciences and then chose to further specialize in just the hearing system and receive a doctorate in audiology after 4 years. During that time, they spend a lot of time in classwork understanding the anatomy of the hearing system, hearing aid solutions, cochlear implants, so the problem, understanding hearing loss, and all the possible solutions that could entail. They're also trained in depth at understanding the limits of their scope of practice and knowing when it's time to refer to an ENT physician for their medical perspective. So I'm an audiologist. I have a doctorate in audiology from UNC, and I've specialized in all things hearing loss and specifically hearing aid specialization, so programming of hearing aid devices. But I'm also well versed in all the other kinds of treatment, and when patients come in and they don't need hearing aids, I know exactly who to send them to receive the proper care. After audiologists, you might run into hearing instrument specialists. These are providers who specialize in pretty much hearing aids. It's a mentorship and a training. It's not through an official university institution, and there's no official degree through a university as a result. It does take a bit of time to complete, but it's more around 1 to 2 years versus 8 years of educational training that an audiologist goes through. They specialize in all things hearing aids, but they are less well versed in things like diagnostic testing, cochlear implants, ENT referral, and tinnitus management. Lastly, we have audiology assistants. These are providers who specialize in supporting the audiologist in their day-to-day tasks. So for example, an audiology assistant might help with the cleaning of hearing aids, but they're not going to diagnose hearing loss or recommend what type of hearing treatment would work best for that patient. We do have some exciting news in our clinic. Our practice manager, Dawn, is currently undergoing training to become an audiology assistant. We are super excited about this news because we are just growing like crazy, and she's going to be able to help with the day-to-day operations of maintaining our equipment, sending things off for repair, and helping with last-minute drop-in or walk-in appointments. So we're really excited. She's doing a great job in her training, and I think that's only going to be a great thing moving forward. I hope you learned a little bit about audiologists, hearing instrument specialists, and audiology assistants today. If you notice, we don't have a hearing instrument specialist here, but you might run into those in other clinics. Of course, make sure you advocate for yourself and learn exactly who you're working with, what their role is, and what their limitations are. If you have any questions, give us a call. Otherwise, have a wonderful rest of your day.